Hey Zach,
Hey, how are you? How are you?
good. How are you doing?
I'm doing well, thanks. Nice to meet you, face
Oh,
to
I
face.
know. Yeah, it's really nice to meet you. Yeah, we just been talking through email. Sorry on the delay sometimes.
No, no, that's okay. I know, everybody's busy. Same on
Oh
my.
yeah, yeah, for sure. I like your view though in the background.
Oh yeah, thank you. I live in the middle of the woods, so it's nice and peaceful. I don't know if you're gonna hear it through the camera, but I've got like birds chirping outside and all kind of good
Oh,
stuff.
I love that. Yeah, that looks really peaceful.
Yeah.
We don't have it too much. I'm over in Arizona. Where are you at again?
I'm in Connecticut, but
Connecticut.
I'm originally from Arizona, so I know,
Oh, really?
yeah.
That's so cool.
Born and raised in.
Oh, cool. Cool. So you are familiar.
Yeah.
Okay. Awesome. Yeah, you know what? We can go ahead and start. And, I just want to introduce everyone to Zach. He's with Constant Therapy. I'll go ahead and let you take over and you can introduce yourself and what Constant Therapy is about
Yeah, yeah.
for the audience. So,
Thanks so much.
yeah.
Hi, everybody. My name is Zach. I'm a speech language pathologist. I've been an SLP for the past 10 years now. I've worked with stroke patients and stroke survivors pretty much at any level of care. So, starting at an acute care center for someone who's maybe just had their stroke, all the way on up to, meeting people in their homes and at outpatient centers for people who, may still be working to recover from their stroke years later. And working with individuals who've had strokes is a passion of mine, and I'm just so excited to be on this live and to be able to speak with everybody. As far as constant therapy goes, for those of you who aren't familiar, Constant Therapy is an app-based platform. Currently, we're hoping to change that to make it a little bit more accessible soon, but currently we're available on different iOS devices, Android devices, and what we do is we make it so that individuals who are affected by stroke or brain injury or any other condition have access to various different speech, language, and cognitive exercises so that they can continue those exercises and continue their recovery even when they're not working, directly inside a session with a therapist. So the whole goal is to make sure that everybody has access to exercises that we know work, that evidence shows us works, and that's something that you can find within the constant therapy program.
Yeah, I really love that and taking advantage of technology nowadays too.
Yeah, especially since, I mean, even, before COVID, but since the pandemic, just, technology has exploded. So, being able to be a part of that and to help reach, many different people, some of whom can't even connect with a therapist because of where they live or, other access issues, it's very rewarding.
Oh, big time. So today, yeah, we're gonna discuss a little bit about aphasia, right?
Hmm.
And you're gonna elaborate more on that to educate us.
Hmm.
Yeah.
Yes, I am. All right. So do you want me to just jump in
Yeah,
and
yeah, go for it. Yeah, it's up to you, unless you want to do
yeah,
it.
yeah, sure. So aphasia is an acquired language disorder, and when we talk about language, um, a lot of people in general don't have a good grasp of what that is compared to something like speech. So I kind of want to start, with the difference there, and then we can kind of go into more of what aphasia is. So when I go between speech and language, I like to do, or I like to use a computer as an example. So when we have our speech system, that is like the hardware of the computer. That's, for you as an individual, that's your tongue, your lips, your soft palate in your mouth, and how all those different structures are moving together to produce sound and words. On the other end, we have language, which, if I'm going back to my computer example, that's more like your software. And that's really the sentences you produce, how you produce them with the words going in the correct order, choosing the correct order, things like that. You also have your ability to understand what others are saying to you, and then that expands into how you write and how you read and understand what you're reading. So those last four, the getting the right words out, the sentence structure, understanding, reading, and writing, all of those encompass an aphasia, which, like I said earlier, that's that acquired. So something has to happen to cause the aphasia. And the most prevalent diagnosis for that is stroke, particularly on the left side of the brain, impacting, there's multiple different areas, but if we break them down into kind of what are considered the top two, there's one that's kind of right here in the front called Broca's area, which is more so the expression or getting the words out area. And then the area kind of towards the back here, it's referred to as Wernicke's area, and that's more where that understanding language is housed. But there's a whole bunch of other different structures involved. That could be its own separate talk on how the brain works. But anytime those areas are impacted, they can lead to an aphasia, and it really can impact anyone in various different ways. There are different diagnoses and different patterns that we see. For profiles that are a bit more common. So, going back to those two areas that I said, we have Broca's area, we can have a Broca's aphasia. And there are certain criteria for that. If we go back here, we have Wernicke's aphasia. And there's a whole host of other different ones, and they're really based on, how easy it is for someone to get the words out, how often they're having trouble getting the right words, how much they're able to understand, and even down to, are they able to repeat? Because there's a pathway in the brain that modulates our ability to, repeat after someone. So if I say repeat after me, that's a whole different pathway. So we kind of take a whole bunch of information and kind of come up with a diagnosis. But at the end of the day, for me, as a practitioner and a provider, labels are important to some degree. But for me, I care more about, what is the person that I'm sitting with and working with? What do they do well, and what are they coming to me for help for, and how can I best help them? That is what I care about, really kind of digging in on someone's aphasia on my end.
Oh. Yeah, I hear talk about aphasia. I know, especially in the beginning of my stroke, I did experience some parts of aphasia, but just having you break it down like that, I really appreciate that. And you just simplified it.
Yeah, of course. I mean, it's like I said, it's getting to the point, like there are so many different labels for it, but knowing what you're looking at is really important as far as being able to help someone. So I think that's where it's important that those labels come in. But like I said, aphasia impacts everybody differently, and I think this is something that you can appreciate, where you said you dealt with aphasia at the beginning of your journey. Unfortunately, a lot of people who end up diagnosed with aphasia, people in the medical community can tend to talk to them like they've lost their intelligence, and I pray into that, they don't know what's going on territory, but that's not the case. Aphasia is truly a language disorder. It impacts your ability to communicate. You're still yourself on the inside. You still have the intelligence you had pre-aphasia. It's just expressing what a lot of people who I work with say, in my head, everything makes sense. It sounds like I did before my stroke. I can't express that outwardly. So knowing that, your intelligence is impacted is I think an important part of aphasia, where you're still just as intelligent as you were beforehand.
Yeah, thank you for mentioning that. Chito WLA said, I have trouble talking when my batteries are low. Sounds like a huge drum. I relate. Can you,
Yeah.
I guess, elaborate a little bit more on that and why, maybe?
Yeah. So I'm gonna assume batteries are low, meaning you're tired.
Yeah.
That is very common in individuals who've had strokes, where your brain is working to recover. And if you think about, just pick a time before your stroke. If we have a long busy day, by the end of the day, you're tired, you're fatigued, you don't want to talk, you don't want to think, you just want to rest. But that kind of fatigue can set in quite a bit earlier in individuals who've had strokes. So if you're going about your day, that fatigue can start to kick in, and it can really manifest in those speech muscles, where you sound like our friend here said, drunk at the end of the day, where
Yeah.
it's your muscles are just fatiguing, and you rest, you recuperate, you wake up the next morning, and you sound better. It's it's just a little understood, but unfortunately all too common part of dealing with the outcomes after a stroke.
Oh, okay, thank you. Yeah, that makes complete sense. I feel like when that happens to me, sometimes I get, I used to have foot drop, and so sometimes it comes back as well.
Hmm.
So yeah, that makes sense. So that's good to know that it's normal.
Hmm. I see Cheeto WLA saying this is sleep good, and I'm better. And that's exactly it. Good rest really does help kind of perk things up. And what I when I work with people, kind of what I say is know your triggers as far as something that might make you more fatigued than just the average amount of fatigue. And if you know that's coming up through your day. So sometimes people will tell me going to the doctor, or going out to lunch with my family is really fatiguing. So I'll say, if you know you have something like that coming up, don't overexert yourself beforehand. That way you don't you're not dealing with as much fatigue when you get to whatever event you're looking forward to.
Oh yeah.
um,
Yeah.
so that's just something that people can do to kind of help push back that fatigue to later in the day.
Oh yeah, big time. So on that beat, ask how can I better communicate with my uncle with aphasia?
That's a really good question. And the sad answer is there's no universal just way I can tell you to best communicate, because like I said earlier, everybody with aphasia has different patterns of strengths and weaknesses. And how you can best communicate with an individual is really important based on their particular skill. That being said, Pete, I like uses constant therapy. That's awesome. I love to hear that. Uh, but as far as kind of general things that you can do, I think the best thing is, one, just be patient. Like I said, individuals with aphasia know what they want to say. It's not that they don't know what they want to say, it's they can't say it. So being patient with them, giving them the extra time to try and get those words to come out, can really be helpful in terms of establishing good rapport between you and the person that you're speaking with. I love that. I'm patient. I see that. That's awesome. Other things that you can do, it depends on the person, but sometimes people will want others to help them try to find the right word. So they'll say, it's okay to help me. And other times people are totally against that. They don't want
Oh,
the help, to work on it on themselves. So I think the most important thing with that one is ask your loved one, or whoever you're speaking to with aphasia, do you want my help if you get to a point that's troubling for you? Other things you can try are repeating yourself. Sometimes people might feel like it's bad to repeat themselves over and over, but that repetition can actually help a person who does have difficulty understanding better understand what you're telling them. So you can repeat, you can change the way that you're saying things to them. They may not understand it, phrased one way, but if you change the way you said it and it's the same message, they may understand it better that way. Other things you can do are include what we label as visuals, and in speech therapy. So you can do pictures, you can do gestures. So for example, I might not be able to get the word hammer to come out, but if I go, like this, that's very universally, everybody knows that's a hammer. I'm hammering a nail. So even, those sorts of things can really help get, your point across, help your loved one communicate back with you. But really finding out what works best for them is kind of my, top number one recommendation.
oh, awesome. Yeah, Zach, I really love that. I think it kind of ties in with communication, and talking to people too. And I understand what you're saying. It can't be just a one size fits all type of answer. But I think the way you responded, it really, it can hit a lot of people too. So great. Thank you.
Of course.
See, yeah, Cheeto said, I tell my family kids to read my medical records and understand what I went through.
I, I love that. So Cheeto, I think that's great, and I hope more people do that. I know in particular it can be difficult for younger kids to understand too. If when you say your kids, they're younger because they don't even have a good grasp of what a stroke is, and
Mm.
then you're further with aphasia. And I know that recently, with cases like with Bruce Willis. Like I can't remember her name, but the other daytime talk show host, Wendy Williams,
Oh,
a face
she had it too.
more well known. I know
Yeah.
I can't think of the titles of them, but I've seen books that are geared towards kids, as far as something like Grandpa has aphasia, so that they're able to learn about these topics in ways that are accessible to them. So I love that you have them go through the medical records. That's such a great way to increase understanding, and I hope anyone listening, if you're comfortable sharing that, you take Cheeto's example, and find a way to help your family understand and help others around you understand, because when we build understanding about aphasia, that's where learning and acceptance comes in too.
Awesome. I wanted to ask you, as far as what you've seen with aphasia, a lot of times with these practices, they can really help to improve aphasia. That's what I'm assuming, right? Yeah.
Hmm. As far as therapy.
Yeah, as far as the therapy.
Yeah. So the number one thing that I tell anyone that I work with who has aphasia is, I wish I had a crystal ball to tell you, how you'll progress, and how far we're going to go. And again, everybody's different. Recovery is different for everybody. But
Mm-hmm.
the number one thing that I say is, as long as you stay motivated, you have family, friends, neighbors, a community group, anybody that you have access to that can act as, kind of like your cheerleader, to help cheer you along so you stay motivated. That's a huge piece of it. Because if you lose motivation, you don't want to do the therapy. Some people stop, and progress can stop. But as long as you stick with it, I've worked with people who are 20 plus years post their stroke,
Oh,
and they're still making progress because they've stayed motivated to keep going. And then obviously on top of the motivation, making sure that what you're doing in therapy, there's evidence to show it works. Because just like any field, there are things that can be done that are just the norm of, this is what's always been done, but that doesn't mean that it's correct anymore. And that's why I said that with constant therapy, I brought up that evidence, because to me, that's important. I don't like spinning people's wheels. I don't like having them just do exercises for the sake of doing exercises. I want them to do exercises that I know will work for them. So motivation and making sure that whatever you're being provided does have that evidence behind it. Those are two really important pieces.
thank you.
Mm-hmm.
Yeah, I really attest to that, and I'm a lot different now. I think repetition for me, I did it a lot, and so now it is a lot different.
Mm-hmm.
But yeah, just hearing that from you, I really appreciate that.
Of course.
So Elsie Romero said, "My son is almost 14 and hates doing OT. Trying to find other ways to help trick the brain to help his post-stroke hand have more function." That's it.
So that I wish I could give you an answer on, Elsie. I am not an OT myself,
Yeah.
and I don't want to tell you something that might be inaccurate. If he doesn't like doing OT or going to the occupational therapist, my best recommendation would be to talk to either the OT that he has been going to, or to try and find another OT that he might feel more comfortable with. But talk to them about what are things we can do at home to really help his hand. So that might be, if your son, I think you said your son was 14, he might really like video games, for instance. So maybe, spending a little bit more time, on the video game to work on his hand dexterity, something like that.
Uh,
But definitely talk about that with an OT, just to get their stamp of approval on it. I don't like to recommend things outside of my own scope of practice.
Oh, that's the perfect answer right there. I think you don't always, I guess, vibe with everybody, so sometimes it is good to try other people to keep your options open.
Yeah,
For
exactly.
me, I think what helps me a lot too is the internet too, and having this platform. I think you can. It allows you to search around a little bit too, in case you want to test out the waters.
Yeah, yeah, exactly.
Yeah, but Zach, I really appreciate your time today and educating us. I learned so much today, and I'm glad that you educated me.
Oh, I'm happy to be here. Thank you for the opportunity to come in and be the live with come in and do the live with you.
Yeah, thank you. And then also we did the what's it, the giveaway with Julia.
Yep, yep,
Oh, that was awesome. Yeah.
yeah.
But yeah, Zach, thank you so much for your time. I just yeah, make sure you guys are following Constant Therapy, and try out their app too, because
Yeah,
it changes lives. Yeah.
most definitely. And if you are trying our app and you need any help or want to talk to me or my team, you can reach out to us. We have email, we have, our phone line. We're always here to help and happy to do it.
All right. Thank you everybody for joining today. Thank you, Zach. And
Thank you.
you have a good weekend.
You-
All right. Have a good one. Bye.
Bye.